Understand your blood glucose levels. One of the best ways to understand your diabetes is by monitoring and managing your blood glucose levels. It will help you to avoid highs and lows. It will help you to recognize how things like food and activity can affect your diabetes, and it reduces the risk of developing complications in the future, from problems with your feet and eyes to gum disease and even cancer. This is especially important for us as people of African-Caribbean heritage are more susceptible to high blood pressure, which increases the risk of some diabetes complications, in particular strokes. So how do you monitor your diabetes and help reduce these risks? There are two main ways to measure your blood glucose levels. Having an HbA1c test, which gives an average of your levels over the past 2 to 3 months. This is usually done with your healthcare practitioner at the GP surgery. And testing yourself using a finger prick test or using a flash glucose monitor or continuous glucose monitoring device. An HbA1c is a blood test taken by one of your healthcare team. An ideal reading is 48 millimoles per mole, 6.5% or below. However, you should receive your individual target. It's vital that you have this test done at least once a year. But if your HbA1c is too high, it will be done every 3 to 6 months instead. If you've been asked to test your blood glucose levels yourself, there are a number of ways that you can do it. But in general, people living with type 2 diabetes are looking to keep levels below 7 millimoles per litre before a meal and below 8.5 millimoles per litre 2 hours after meals. However, whether you are living with type 1 or type 2 diabetes, the levels you should aim for need to be agreed with your healthcare team. Anything above your individual advised upper limit is called a hyper. If you're living with type 1 diabetes or have type 2 diabetes and taking certain medication, check with your doctor or nurse if you're unsure. Then you also need to be aware of hypos, which is when your blood glucose is too low. Hypos can happen when the balance between either the food you eat, your physical activity, and the medication you're taking isn't quite right, and tends to show by your levels dropping below 4 millimoles per litre. Hypos can happen quickly, so it's important that you're aware of the symptoms, ranging from feeling weak, dizzy, or sick, to experiencing blurred vision, headaches, or heavy sweats. It's important you treat a hypo immediately with 15 to 20 grams of fast-acting carbs, like a small carton of fruit juice, or 4 jelly babies, or 2 tubes of a glucose gel. After having a hypo, you may need to eat slower-acting carbohydrate, like a piece of fruit or a glass of milk, to stop your glucose levels going down again. It's also key that you inform family and friends of what a hypo is, so that they can spot it and know what to do if it happens.